Hey everyone, today I'll be talking about schizophrenia. Schizophrenia is a psychotic disorder wherein there is loss of awareness and loss of contact with reality. That is why it is also called as split mind. Eugene Bleuler defined the fundamental symptoms of schizophrenia, which are also known as 4 A's of Bleuler. It includes first, what we have is autism, wherein there is decreased social interaction. Second, what we have is ambivalency, which is defined as indecisiveness between two thoughts. Third, what we have is affective flattening, which can include loss of emotion. And fourth, what we have is association loss, wherein there can be disorganized thoughts. Kurt Snyder also defined the first rank symptoms of schizophrenia. First, what it includes is disorder of thought. Herein, there can be thought insertion or there can be thought withdrawal. Also, there can even be thought broadcast. Second, what we have are disorder of perception, which includes auditory hallucination. Now, these auditory hallucinations can be of three types. Either there can be a first-person auditory hallucination, wherein the individual hear his or her own thought as voices. Second, what we have are second-person auditory hallucinations, wherein the individual hears one voice in ear like a command. And third, what we have are third-person auditory hallucinations, wherein the individual hears two or more voices in ears like a running commentary. Next, what we have in first-hand symptoms is made phenomenon, wherein the individual says that I have been made to do this. It includes feeling, action, and impulse. Apart from these, we can also have somatic passivity in the first rank symptoms, wherein the patient can have bodily sensation. Also, there can be delusional perception in the first rank symptoms, wherein the normal perception has an illogical meaning. Apart from these first rank symptoms, there can also be delusions, which are defined as false, unshakable beliefs. The person can also have a disorganized behavior. Apart from that, there can be some negative symptoms, which include anhedonia, which is defined as loss of pleasure. Also, there can be apathy, that is loss of emotions, and there can also be loss of motivation. The exact cause, or say the etiology of schizophrenia, is not known, but it can have a genetic association. Some theories say that it is because of altered neurotransmitter levels, wherein the levels of dopamine are increased, the levels of norepinephrine are reduced, and the levels of serotonin are increased in the body. A few factors can define the prognosis of schizophrenia, some of which I have discussed here. For instance, if there is a late onset of schizophrenia, then it will have a good prognosis as compared to early onset, which will have a poor prognosis. Also, a female is likely to have a good prognosis as compared to a male who will have a poor prognosis. Now, once diagnosis of schizophrenia has been established, you need to go for its treatment. It involves medical management wherein you give antipsychotics. Now, do remember that you prefer atypical antipsychotics over typical antipsychotics. So this was all about schizophrenia in brief. Here is the overview of what I have discussed. If you think this video was helpful, do like this video, share this video and subscribe to my channel. Also, you can check out my video on mania. Thank you.